In the second section, now we will discuss about some other forms of non-allergic rhinitis. In the first section, we discussed the vasomotor rhinitis, which is one type of non-allergic rhinitis. And the other forms which we will talk about is drug-induced rhinitis, rhinitis medicamentosa, then rhinitis, which is associated with pregnancy, honeymoon, and emotional rhinitis. Then also we will talk about gustatory rhinitis and non-airflow rhinitis. So first, what are some other forms of non-allergic rhinitis? Is drug-induced rhinitis, rhinitis medicamentosa, rhinitis of pregnancy, honeymoon rhinitis, emotional rhinitis due to hypothyroidism, gustatory rhinitis, and non-airflow rhinitis. So these are all the rhinitis which comes under the classification of non-allergic rhinitis. So we will discuss all these different forms of non-allergic rhinitis one by one. So first, the drug-induced rhinitis. So as the name shows, it is the rhinitis or inflammation of the nasal mucosa as a result of the drug or drugs which are used for different purposes. Sometimes they can cause rhinitis. The common drugs that can have this effect is antihypertensive. So antihypertensives are the drugs used for high blood pressure and to control the hypertension and blood pressure. Not all antihypertensive have this problem. There are just few drugs that can cause drug-induced rhinitis, and these drugs are reserpine and guanethidine and some more also, but the commonly used drugs which can have this effect is reserpine and guanethidine. These are the drugs used for high blood pressure. So if some patient is using these hypertensive drugs or antihypertensive drugs and they complain of rhinitis, or they complain that they constantly have this problem and it's not going away, make sure to ask them which type of medicines they are using, what drugs they are using. So it might be due to drug-induced non-allergic type of rhinitis. So reserpine and guanethidine are the antihypertensives that have this effect. Other medicines, we have sympathetic blocking agents. Sympathetic blocking agents, propranolol, and this can cause nasal stuffiness. So nasal stuffiness is caused by the drug propranolol. Propranolol is commonly used by different patients for blood pressures also, and for heartbeats abnormalities and to calm the heart. So propranolol causes the nasal stuffiness. Anticholinesterase drugs, which have this problem and cause neostigmine. Neostigmine is the drug that can cause nasal obstruction. So the propranolol mainly was causing nasal stuffiness, and this again same more or less one stuffiness and obstruction. So neostigmine caused nasal obstruction. And then we have some contraceptive pills which cause obstruction because of the estrogen hormone present in contraceptive pills used for contraception or to avoid the conception or pregnancy. So these are some common drugs that have the effect and that can cause drug-induced rhinitis. If patient is on these medicines and they keep coming and complaining of the same symptoms again and again, then make sure to change or switch the medicines they are on. Then another term or rhinitis is rhinitis medicamentosa. So this type of rhinitis is usually because of topical, if too much medicine is used, this can cause, and they are topical decongestant, they have the rebound phenomena. Excessive use cause rhinitis. So now again these medicines, the excessive use of these medicines cause rhinitis, and the name is rhinitis medicamentosa, and then the stoppage of these medicines usually cause the condition better. So it's excessive use cause rhinitis of some decongestant. Treatment is withdrawal of nasal drops. If too much nasal drops or decongestants are used, they sometimes have this phenomena and they can exaggerate or exacerbate the condition. So the treatment option is decrease or withdraw or completely stop the nasal drops or decongestants. Systemic steroids therapy, and then surgical reduction of turbinates if present. If turbinates are hypertrophied, surgical reduction or decrease in the size of the turbinate also help. So this is rhinitis medicamentosa. Rhinitis of pregnancy. Due to hormonal changes, as we mentioned in the one of the drug that have this effect is the contraceptives because of the estrogen hormone. During the pregnancy also hormone levels are elevating, increasing. So increased level of hormones or estrogen especially cause nasal obstruction, nasal stuffiness, and that can lead to non-allergic type of rhinitis. So due to hormonal changes, the edema mucosa become edematous, it becomes swollen, it swells up, and this swelling now causes the blockage of airway. So it causes nasal obstruction, and the reason behind this nasal obstruction is the changes in the hormone levels during the pregnancy that can cause blockage of the airway and cause nasal obstruction. And then once there is blockage or obstruction, the secondary infections are common, and usually they have sinusitis develop. They keep on complaining headaches and stuffiness or obstruction and loss of smell and all these complications. They keep on complaining. So this is mainly due to changes in the hormone levels that occur during pregnancy. Treatment is careful while prescribing drugs. We cannot prescribe lot of medicines during pregnancy. So be very careful when the medicines are prescribed. Limited use of nasal drops, little use of topical steroids, limited cryosurgery, and avoiding antihistamine. So because the patient is pregnant, medicines should be given very, very cautiously, carefully, and you can use some medicines but to a limited amount, and some medicines should be avoided. So this is the rhinitis of pregnancy. Next, honeymoon and emotional rhinitis. Honeymoon rhinitis is usually the after sexual excitement. This can occur. There is a short period of rhinitis and rhinorrhea and runny nose because of this emotional changes, and the reason behind that is also as we mentioned in vasomotor rhinitis, the activation of sympathetic nervous system, parasympathetic nervous system, that is very, very closely related to the emotions. So there is honeymoon rhinitis, and then emotional rhinitis is due to psychological states like anxiety and tension. So both these conditions, they are very, very closely related to what we mentioned, what I mentioned in the vasomotor rhinitis. There is involvement of the sympathetic, parasympathetic nervous system, and when emotions are involved, there is activation of the system that can cause hyperactivation of mucosa, hyperstimulation, production of nasal secretions. All these changes can occur in this emotional and honeymoon rhinitis. Treatment is counseling for psychological adjustment if patient has anxiety issues, tension issues, or depression that should be handled psychologically. And then imipramine. Imipramine is the drug used for depression, and it can be used if patient has these complications, especially emotional type of rhinitis. Then rhinitis due to hypothyroidism. This is the thyroid gland. Thyroid gland is present in the neck, thyroid gland. It's very important gland that produce the hormone thyroxine, and that thyroxine is involved in metabolism in the body. So decreased level of thyroid hormone or hypothyroidism. Hypo means low, thyroid, so hypothyroidism can also lead to rhinitis, and thyroid is the hormone that is involved in the metabolism. And then there is hypoactivity of sympathetic system. So the hypoactivity, because it's hypothyroidism, all the different functions of the body are affected in hypothyroidism. They are to the lower side. So hypoactivity of sympathetic system, hyperactivity of parasympathetic system. Nasal stuffiness and colds are common. Patient is very cold anyway in hypothyroidism because the metabolism is low. So they feel very cold. Their hand and feet are cold all the time. As a result of that cold, also they have this coldness. They feeling of cold, and cold is also very common. So that's hypothyroidism. Treatment is for hypothyroidism is replacement of thyroid hormone. Then gustatory rhinitis is very common. All of us can have this when we eat, especially the spicy food that can cause the runny nose and tearing of the eyes. And this is known as the gustatory rhinitis. And the mechanism behind that, what causes this is it causes cholinergic response. There is release of the acetylcholine, and it is due to spicy and pungent food cause gustatory rhinitis. There is rhinorrhea, nasal stuffiness, lacrimation, sweating, and flushing of face. All these are very common. If you eat spicy food, you can have the sweating, lacrimation, flush. Even if it's very, very cold and you eat the hot, spicy food, these can occur, and this is known as gustatory rhinitis, and it is as a result of cholinergic response. Treatment: ipratropium bromide nasal spray. Ipratropium bromide is usually prophylactic medicine that that avoid this attack to occur. So ipratropium bromide nasal spray can help to slow down or decrease the effect of the spicy and pungent food. So ipratropium bromide is not used for the acute attack. Even when the attack occurs, when the rhinitis develops, it's not effective, but it's very effective as a prophylactic medicine to prevent the attack of gustatory rhinitis. Then the other term, non-airflow rhinitis. Non-airflow rhinitis is in patients when the non-airflow rhinitis is self-explanatory, airflow is not occurring. So in patients who have laryngectomy, when the larynx is removed and they have tracheostomy, the airflow is not the normal airflow, is non-airflow rhinitis. So in laryngectomy and tracheostomy, there are swollen turbinates, nasal blockage, and choanal atresia or adenoidal hyperplasia also cause obstruction. So all these are the non-airflow type. Swollen adenoids is a common cause of airflow obstruction, and then as we mentioned in the previous lecture also, we talked about choanal atresia when there is blockage of the passage, and then this can cause nasal obstruction also. So all these are common types of non-allergic rhinitis, and if you notice signs and symptoms, treatments are pretty much the same as allergic rhinitis. So the difference is mainly in the pathogenesis and how it develops and how it is caused. That's the main difference between the allergic and non-allergic rhinitis. Then stagnation of discharge is also one of the example of non-airflow rhinitis or cause of non-airflow rhinitis. If there are secretions and they become stagnant and they are causing airflow obstruction, then it's an example of non-airflow type of rhinitis. So this was all about section 2. Thank you for watching sqadia.com.